Ebola spreads again in Texas. We learned overnight that a second healthcare worker tested positive for the virus. That victim is isolated this morning. The worker was on the team that treated Thomas Eric Duncan. Duncan died after becoming the first victim diagnosed in this country.
This morning's news comes on the heels of a scathing review for Texas Health Presbyterian Hospital. Manuel Bojorquez is in Dallas, where a nurse from that hospital continues fighting the disease. Manuel, good morning.
Good morning. Now that a second worker has tested positive, there are 75 other healthcare workers here who are being monitored for symptoms for possible exposure to the original Ebola patient. A new case also means that yet another Dallas home is being decontaminated. The process started there as soon as the diagnosis came down. The nurses at the hospital are non-union, but that now the nation's largest nurses union is speaking out on their behalf, saying those nurses fear retaliation for exposing flaws that may have led to their co-workers' infection.
It shouldn't have happened to her. It shouldn't have happened to Mr. Duncan. It shouldn't have happened to anyone.
In a conference call Tuesday evening, the union, National Nurses United, read a statement and answered questions on behalf of nurses who they claim work at Texas Health Presbyterian. They alleged the Dallas hospital was unprepared to treat Ebola patient Thomas Duncan.
Were the protocols breached? The nurses say there were no protocols.
According to the union, nurses employed by the hospital listed numerous flaws connected with Duncan's treatment, including initially leaving the patient for hours in a non-quarantine zone, insufficient gear provided to hospital personnel, and unmandated hospital training procedures and policies for handling patients with Ebola.
The message to the nurses was, it's up to you. It is not up to the nurses to be setting the policy, the nurses say, in face of a virulent disease.
In a statement, Texas Health Presbyterian Hospital responded, saying, "Patient and employee safety is our greatest priority, and we take compliance very seriously. We have numerous measures in place to provide a safe working environment, including mandatory annual training." 26-year-old nurse Nina Pham, who helped treat Duncan at the hospital, tested positive for Ebola on Saturday. Her condition has been upgraded to good. And in a statement yesterday, she said, "I am blessed by the support of family and friends and am blessed to be cared for by the best team of doctors and nurses in the world here at Texas Health Presbyterian Hospital, Dallas." And we're now getting a better view of that Dallas neighborhood where the third decontamination to hit Dallas is taking place. That is a process that could go on for days. National Nurses United did not identify the nurses who made those accusations. They were unwilling to even say how many nurses were involved in the statement that was made. The hospital says it will continue to work with employees who raise concerns. And the CDC said it acknowledges not acting fast enough in Dallas and would not be surprised to see additional cases. Charlie?
Manuel, thanks.